Days after the province announced its plan to continue to increase the scope of practice for more health professionals, including optometrists, chiropractors, and psychologists, some experts have concerns that this could be a move toward privatization.
If some of these things like the tests and outpatient care are delivered by non-physicians, who's going to pay for them?
While the Ford government has maintained that Ontarians will not have to foot the bill despite increased private sector involvement, in June the Ontario Health Coalition filed a complaint to the province on behalf of 50 patients who claimed they'd been charged fees for health care at private clinics. The government called those fees illegal and said anyone charged for an OHIP-covered service would be reimbursed. Health policy expert Reza Dieber says we need to know more about how these services are being regulated.
It could be an opening for increasing the total costs, but downloading them from government onto private insurers or individuals having to pay for that care.
The Ontario Health Coalition backs that concern, telling City News, "The public should be warned. They are privatizing our health care. It is a real threat to the cost of living for all of us." The Ministry of Health says that's not the case, and the goal of the expansion is to connect people, no matter where they live, to convenient care while reducing unnecessary pressures on hospitals. Among the proposed changes, optometrists would be able to perform minor surgical procedures, regulated health professionals like chiropractors could perform X-rays, MRIs, and CT scans, and psychologists trained in psychopharmacology would be able to prescribe certain medications, such as antidepressants. Dr. Diana Velaconia believes they are more than qualified.
So in addition to our PhD and other internships, residencies, and so on, this is a 2-year Master's of Science degree in clinical psychopharmacology. So it covers all the didactics, it covers all the practicalities, ordering, reading lab tests.
And she adds, there's evidence this practice works.
In the states where there are prescribing psychologists, there are lower suicide rates, better health outcomes, reduced emergency visits, and so on.
Under Ontario's plan, pharmacists would also be able to assess and prescribe for an additional 14 ailments. Now, it's not clear how soon the measures could be implemented. Michelle Mackey, City News.